Okay, this is the grant writing workshop for the 2017-2018 grant cycle of Susan G. Komen here in Utah. So just a little bit of information about who we are as an organization. Our vision is a world without breast cancer, and our promise, save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. So this is part of the meeting the critical needs in our communities. We are a small staff. We have 4 currently and 1 position that is currently open, which is our development. We have a very active board of directors and hundreds of volunteers that provide tons of hours of service to help us with our fundraising needs as well as other activities throughout the year. So we raise money. We serve the entire state. We support breast cancer research. We raise awareness of breast cancer, provide educational resources. We participate in advocacy, and we grant money to local breast cancer programs. So our impact in Utah since 1997, when the affiliate was founded, we have invested over $8 million in both research and community grants. Over $6 million of that has stayed locally in Utah to fund community health programs. And we have given $2 million to our headquarters for research, but more than that, over $2 million has actually come back to Utah for research projects like the Huntsman Cancer Institute, which we're really, really excited about and proud of. We're more active in the statewide coalitions, and we're becoming more active in policy issues from the Medicaid expansion, advocating for research funding, oral parity at the federal level, and then funding for the breast and cervical cancer early detection program, which provides free screenings and treatment for women who are uninsured and low income. So just a quick overview of the community grants process. So as I mentioned, the majority of the money that we raise stays here. So 75% of our net funds are going to these community grant programs, and then the other 25% going to research. So we work along a continuum of care. So you'll see that education is necessary at every stage of a woman's journey through this continuum. Education to bring them into screening. If it's normal, going into follow-up. If it's abnormal, going into diagnosis. And then if they are diagnosed, then going into treatment, and then from treatment into follow-up and or survivorship care. And then it starts over again. So it's a continuum and a constant cycle. This is a little bit about our process. So I'll talk a little bit about our community profile in a moment, but basically we do a community profile needs assessment. We learn from that, and then we create an action plan. We develop an RFA, which is this point we're at right now, actually holding a grant writing workshop to let people understand and know what it is that we're looking to fund. We'll conduct a compliance review of all applications that come in. We will have a review panel that reviews, independent review panel that reviews the applications. We will obtain board approval and then award grants and execute the contracts. We then manage and monitor the grants and evaluate the impact, and then the process starts over again. These are a few important dates that you need to keep in mind. The last day to begin an application in our grant system is Friday, November the 11th at 5 p.m. The last day to submit your application is Wednesday, November the 16th at 5 p.m. We separate those dates so that people don't start an application the day that it's due, because it's a pretty cumbersome process to get through our system to apply for a grant. So we want to make sure you have plenty of time to get it done, to get it completed. So keep those dates in mind. The next one is grantees will be notified of their award no later than March 31st of 2017. The first check for those grants are upon completion of the contract, and that's going to vary based on the processes of each organization. We prefer to get them done as soon as possible, but again, it sometimes takes a little while with different levels of approvals. There is a 6-month progress report due, and that is due on October the 16th of 2017. And then the second payment of the grant will be issued upon approval of that progress report. We do site visits with our grantees, and those typically take place in the summertime. So it will be the summer, probably late summer, early fall is usually when we get those completed. The deadline to request a no-cost extension will be February 1st of 2018. We will allow, and I'll talk a little bit about this a little bit later as well, but we allow one 6-month extension to complete the program and to spend the balance of the money. And that deadline to request that extension is February 1st. There is a final report that will be due, and the return of any unspent funds will be due at that time as well on May the 15th, 2018, unless you request that extension. Then that 6-month extension will go through September of 2018, and any unspent funds at that point will be due as well. So very quickly about the community profile, what it is. So every 4 years, Komen headquarters helps us do a breast assessment of the needs in Utah. So the entire affiliate network across the country go through this process at the same time, and we are looking for gaps so that we can fund effective and targeted efforts at the gaps within our healthcare system in regards to breast cancer. So we do a rigorous collection and analysis of data. There was a quantitative analysis done looking at mortality rates in late-stage diagnosis for breast cancer. There's a health systems analysis. Then we do qualitative interviews and focus groups and developing plans moving forward. So the one that we just completed was published last year, and these are the target communities that we're looking at. So Utah, Davis, Iron, San Pete, Sevier, and Wasatch counties. Now that does not mean that if you don't serve one of these areas that you cannot apply for funding. We recognize that the majority of the population lives along the 4 counties along the Wasatch Front. So we accept applications from any area. Just know that programs serving these areas will get slightly better scores when it comes to review time. Utah and Iron County have extremely low screening rates, even compared to the state, which the state overall is one of the lowest in the nation for mammography screening. All of these areas need a better understanding of risk and screening guidelines. All areas are projected to miss the Healthy People 2020 targets for mortality and late-stage diagnosis. So again, I mentioned that in the general conversation about community profile, that those are targets that we are looking at. Iron County has a very high uninsured rate and a high number of folks living below 250% of the federal poverty level, and that puts them at risk. All of these areas have a lower than average access to primary care providers, which is actually true for the entire state, but these counties in particular have a low number of primary care providers, and that leads to concerns because the primary care providers have very little time to spend talking about preventative services. They're typically helping with whatever issue the patient came in for, whether it's shots or whether it's some sort of chronic illness or some sort of acute issue that they have come in with. They spend their time addressing those, and those preventative services often get overlooked. And again, the entire state needs comprehensive survivorship support for women and families who have been touched by breast cancer. So quick overview of the request for applications. So you will see when you get in that there are 4 funding categories. And the funding priorities for these categories are here. They are also on our website. They are in each of the RFAs as well. Each category has its own funding priority. And you'll see, I'm not going to read these out. You can read these on your own, but you will see that our primary focus are folks who are underserved, and that can mean uninsured, low income, rural populations, those whose English is their second language. There are a variety of different ways that populations are considered underserved. So being able to identify that and tell us who those populations are will be part of this process. Okay. So I'm going to go a little bit about talk a little bit about each of these categories and some of the things to keep in mind. If you are providing only clinical breast exam or mammography screening, there needs to be a plan within that continuum of care to address diagnostic services as well as referrals for treatment. That has to be included within the application. We don't want to just pay for somebody's screen and then they're on their own having to piece together other resources. There has to be a plan in place to continue to advance them through that continuum without burden. If you are just providing referrals for these services, then you would need to apply in the community health worker category, not the screening and diagnosis. This is only for people who have, who are providing the service or paying for the service directly and have a partnership with a healthcare facility. We ask that you determine eligibility for other programs, whether it's the Affordable Care Act or Medicaid, and utilize those services first if possible. Our money is extremely limited. We wish that we could meet the needs of every organization, but we just can't. We don't have the resources to do that. So we ask that we be the funding of last resort. And outside of the other measurements that I'm going to be talking about that we asked for collection, as far as data is concerned for reporting, we will ask that you identify and report on those who have never been screened or rarely screened, which is defined as over 24 months. We want to kind of get a sense of who the programs are reaching. So, you know, if the majority of your folks are new to the system, that means are new to screening, then that means we're actually making a dent in our screening rates. However, that doesn't mean that if someone already has had a screen that they are somehow excluded. We want people, we know that regular mammograms, so yearly mammograms where the radiologist can compare from year to year, that improves the chances of catching something at its earliest stage. So we definitely want the repeats as well. We just want to kind of get a sense of who the programs are reaching. Next is treatment and treatment support. So treatment is any direct medical treatment to an underserved patient who is in active breast cancer treatment. Treatment support would be material non-medical support, so things like rides to treatment, things along those lines are in this category. Again, the same concept of determining eligibility. And the additional measurement that we request is to identify and report on those living at or below 250% of the poverty level. We want to make sure that our services are reaching the folks who need us the most. Wellness support, again, so this is non-material, non-medical support to improve quality of life measures and address risk reduction for recurrence. These programs can be for people who are in active treatment or out of active treatment, you know, maybe out of active treatment for 5-10 years, does not matter. It's anyone who has been through breast cancer. And again, these are things like counseling services, exercise services, nutrition, education, things along those lines. And then, again, to be able to identify and report on those living at or below 250% of the poverty level. Again, we want to make sure that we're reaching those who have less access to support services. Community health workers. So this is where the majority of the education often happens. But basically, so what we ask is that you educate and connect medically underserved individuals with clinical breast exams and mammograms, and then timely follow-up on diagnostic services. Again, making sure that those folks who need additional screens or additional imaging do not fall through the cracks, that they are indeed navigated through those services. The purpose is to promote behavioral change and empower individuals to do this on their own in the future. Again, we ask about determining eligibility for other programs, including the Breast and Cervical Cancer Early Detection Program, which is run through the Utah Cancer Control Program, which is part of the state health department here in Utah. And then assist in applying for the Affordable Care Act if eligible. And then we also ask that you remove barriers. So whether it's providing transportation to appointments, or providing translation services, or providing child care, or anything along those lines that is a barrier for the population that you're serving, to be able to address and remove those barriers to allow them access into the healthcare system. And then again, being able to identify and report on those who've never been screened or rarely screened. Eligibility requirements. Any nonprofit organization with a 501c3 status or local state government serving anywhere within the state of Utah. Again, I talked about our priority areas, but anyone within the state that's providing services within the state of Utah is eligible to apply. The programs must be specific to breast health and or breast cancer and address the funding priorities that I mentioned previously. The organization is in good standing with the affiliate, and then the organization is free of conviction or fraud or crime involving financial or administrative impropriety since 2015. All of these eligibility requirements are in the RFA on the website and must be met at the time of application submission. So I'm not going to spend a whole lot of time on the allowable expenses. I think they're pretty self-explanatory, with the exception of the indirect costs. And all of this is in the RFA. So the indirect costs not to exceed 10% of direct costs, and the only allowable category for indirect costs to be budgeted for is the $5 million umbrella insurance policy. I'll talk a little bit about insurance in a moment, but I just want to highlight this, that if you're asking for $10,000, then $1,000 could go towards that $5 million umbrella policy. And I'll talk about that a little bit more, but that is the only thing. We will not pay for phones, for rent, for any kind of copier expenses, things along those lines, strictly for that umbrella policy. So restrictions may not be used for research, education regarding breast self-exams and use of breast models, education via mass media, health fairs, and material distribution only. We understand that these areas used in conjunction with one-on-one education, outreach, and other methods can be beneficial, but we will not fund programs that only do these things. You need to be able to, again, that community health worker grant, I already talked about what those requirements are. And then we will not fund any payments or reimbursement made directly to individuals. Granting policies, so the project will need to take place between April 1st of 2017 and March 31st of 2018. No expenses may be accrued against the grant until the contract is fully executed. This contracting process, as I mentioned, can take up, it says here up to 6 weeks. It can take a while for this to go through if you have layers of approvals that are needed within your organization. But please, understand that you cannot have expenses prior to that time frame. Grant payments, I already talked about the installments of how that is paid out. And then I talked a little bit about the no cost extension of no more than 6 months. And then again, that deadline is February 1st. So these are the insurance requirements, again, in the RFA. If you are awarded funding, we ask that we require everyone to have a minimum of a general liability of $1 million per occurrence, $2 million in the aggregate, and then the workers' compensation and the umbrella insurance at $5 million. If you're providing transportation services or any direct medical services, then the liability, the auto liability and malpractice coverage comes into play as well. Let me talk a little bit about that $5 million umbrella insurance policy. We require this as a protection for you as well as for us. We understand that for some smaller organizations that is an expensive policy to be taking out, and that is why we allow organizations to budget in the indirect cost section for payment of that umbrella insurance. So that is why we do it, and that is why that's the only thing allowed in that, an indirect cost. We want to make sure that this is not a barrier for smaller organizations because that can be a huge hit to budgets. Okay, submission requirements. All proposals must be submitted online through the Komen Grants e-management system, affectionately known as GEMS. The website is affiliategrants.komen.org. Again, these links are available on our website and in the RFA. So I already talked about these dates, but I'm going to reinforce them again. Last day to initiate the application, Friday, November 11th at 5 p.m. And then all applications must be submitted no later than Wednesday, November 16th at 5 p.m. No late submissions will be accepted. And submission is a two-step process, and I will talk about this a little bit here, and then in the other video that I'm going to do on the system itself, I will walk you through this. But submission is a two-step process. So the project director will change the status in the system, and this will become more apparent when you go through the system side. Will change the status to authorized signature required, and then the authorized signer, whoever it is within your organization that can sign contracts for the organization, will then go in and submit the application. So understand that these are two separate people, and make sure that whoever you have as your authorized signer is available and able to log in and submit your application for you. Can't stress that enough. If you know they're going to be on vacation, get it done early or make other arrangements. Education materials. We fund programs using education materials and messaging that are consistent with our Komen messaging. There are tons of resources that are available on shopkomen.com. And you can actually look at the website here with the breast self-awareness messaging. We will not fund education programs that teach or endorse the use of monthly breast exams or use of breast models. There's a very good reason for that. If any of you want to discuss that, feel free to call me. All of my contact information is included in this presentation, or email me and I'd be happy to talk you through that. Okay, so quickly, the project narrative. Within the system, there is a page, and it is broken out into these categories this is the narrative of your program. So the statement of need, talking about the evidence of risk or need within the identified population, and then the population characteristics, race, ethnicity, economic status, breast cancer statistics, whatever it is that you have, whatever data or information you have on the characteristics of your target population needs to go here. and then how the program aligns with the target communities and funding priorities that we have laid out. Project design, so this is explaining the goals and objectives and how they align with the priorities. Describe in detail the project activities, how the project will affect the percentage of people entering, remaining, and progressing through the continuum of care. Explain how it's designed to meet the needs of the communities that you're targeting, how the project is evidence-based, and if you have any links to information, there is a spot to upload documentation about how your project is evidence-based. And then to describe the collaborations and how the partners that you work with help strengthen the project and why they are best suited to help. Organization capacity. Explain why your organization are the best suited to lead the program. Describe current successes in delivering breast health services, or other services that you might provide, and the success that you've had there. What resources does your organization have? The physical capacity to manage the delivery of the goals and objectives, current financial state, and internal controls for management of the grant dollars. Do you have the ability to track the money that comes in and how it is spent? And then a sustainability plan to secure and allocate resources after the grant period is over to make sure that the program can continue long term. Monitoring and evaluation. So how will you measure progress toward your goals and objectives? How will you assess, that actually should be assessed, the effect the program has had on the selected priorities? How will you assess program delivery? Just describe how you will be able to determine not only the program success, but also how the program runs, how well it runs, as well as the impact that it has within the community you're trying to serve. So those are two slightly different ways of monitoring and evaluating the program. So I mentioned this a little bit as well. There'll be, with the reporting, you will be required to report on the following outputs and outcomes. So successes and accomplishments, challenges, lessons learned, a promising practice example, and then you will be required to give us a compelling story from an individual that was served with the Komen funding. And in addition, the number of individuals served for each objective, and the information required on this is the county of residence, race and ethnicity, age, and population group for each of the individuals that are coming through. And then lastly, an overall goal or vision of the program. So describe what needs to change for the people served through the program. So what overall vision do you have as far as change for the program? What part of that change is the program accountable for? Describe how progress or success towards this vision is defined, both long-term and short-term, maybe long-term and short-term goals, and then what methods are in place to assess the outcomes towards this vision. Project work plan. You will have one goal, and then you can have as many objectives as you need. So you will create a goal, and then you will be able to create multiple objectives. But your objectives must be, again, specific, measurable, attainable, realistic, and time-bound. All of this information is in the system to help guide you on how to create those SMART objectives. This is a quick example. So provide patient navigation to women with screening abnormalities in order to reduce delays and barriers to diagnostic care. So objective 1 could be during the grant period, patient navigator will contact all women with an abnormal screening within 3 business days to schedule a follow-up appointment. So you see that there's the who, what, by when, and how much. So it's very, very specific. So Key personnel and salaries, they used to be separate pages in our system. They are now combined into one page in the application, which is actually helpful. But what we ask for in this section is the name of the key personnel, job title, role on the project, job description, as well as for any vacant positions. If you are requesting salary in the budget, this is where it will go. So we would need the total salary plus benefits, and then the percentage of the salary spent on the budget. The system will automatically total that amount in the budget item. If you are not requesting salary support, we still need the name and job titles and roles on the project for each of the key personnel members, but you do not need to put anything in the salary section. Only if you are requesting that from Komen for salary support. So again, new this year, budgets, under the budget pages, consultants and subcontracts will be combined, and I will show you this when I do the GEMS presentation on the other recording. Patient care, so we included survivorship support as well in the patient care. These are broken out into categories, you can see, but you can also put in, there's a large section for other that you can put things like wigs, prosthetics, things along those lines can all go here. Project budget summary. So there is a budget summary page, and once you've gone through all of the budget pages, anything that's requested from Komen, hopefully you can see my little arrow here, anything requested from Komen will auto-populate in this area and total at the bottom. So cash and in-kind is, there's a cash section, so if you have other money within the organization that will be supporting this program, that would go in the cash. If you have in-kind, maybe it's a donation of supplies or a donation of time from a provider or something along those lines. Anything that's in-kind, which is provided for you, would go there so that we get a total amount required for the project. So we kind of get a sense of how much of the total budget for this project is being requested from Komen. Hopefully that makes sense. And we'll talk a little bit more about that as well on the GEMS presentation. Supporting documents. So the following attachments are required at the time of submission. So letters of support or MOUs with partner organizations would go in the project profile page. They get uploaded there. There's a spot for that. Resumes and job descriptions goes into the key personnel and salaries page, and then proof of tax exempt status goes into the project budget summary. There is also a couple of other requirements that we ask for to go in that project budget summary page, and I apologize that they're not on this slide, but they are in the RFA, so make sure you read that thoroughly. We ask for a list of your board of directors, as well as an operating budget for the current year, and then a history of expenses and income for 2 years. So that is all laid out, like I said, in the RFA. Okay, quickly, the review process. So review criteria. Our review panel will look at impact, statement of need, project design, organization capacity, monitoring evaluation, and then the overall vision. And you'll see these percentages. So obviously impact and project design have the highest percentage. So a 4 in impact will carry more weight than a 4 in the statement of need. So those are the areas that you should pay the most attention to and make sure that you have clearly communicated the impact and the project design. So there are scoring anchors, and you can see the definitions here. That is also included in the RFA. So compliance review is done by affiliate staff. So more than 3 errors, and all of this is information that's in the RFA, so there shouldn't be, there should not be too many errors. But if there are more than 3 errors, the application will be automatically rejected. If there are 3 or less, the organization will have 5 business days to fix the errors and then resubmit the application to us. So please make sure and review your application before you submit, because I would hate to have to automatically reject an application for you know, a missed document that should have been uploaded. We have an independent panel made up of medical professionals, public health officials, academic, you know, educators, people from the target areas, other nonprofit professionals. We have survivors that serve. So it's a wide variety of individuals that we recruit to review these applications. They score them. There are a minimum of 3 panel members that score each application. So we compile the scores, and then the review panel meets to discuss the ranking and make sure that they feel comfortable and confident that we're putting forth our best slate to the board of directors. The board of directors then votes to approve the grant slate. The only way our board of directors could reject our grant slate is if they feel that something went wrong within the process. They cannot reject it because the program that they wanted to see funded did not make the slate, or vice versa. You know, there's one on the slate that the board, you know, a board member felt, you know, shouldn't get funded. They're not allowed to do that. It is a straight up or down vote, and it only can be if there was something wrong in the process, maybe a conflict of interest that wasn't identified. Oh, that's the other thing. All of our reviewers fill out a conflict of interest form as well, so that we make sure that the process is as fair as possible and we can address any conflict of interest during the review process. Okay, that is the end of this particular section. Like I said, I will have a separate recording getting into the system and walking you through how to navigate those pages. So thank you very much, and we'll see you on the next one.